Hi guys, I'm Becky. Welcome back to Wellness in the Pelvis. I'm a pelvic floor physical therapist here to help you understand more about your body, especially your pelvic health. Be ready for an emotional roller coaster. We're going to talk about why estrogen matters so much, especially to female physiology. So let's shed some light on what's going on down there. Estrogen is definitely a scapegoat, I think, for a lot of what women blame their emotional highs and lows on, and for good reason. There is scientific evidence to support that. But besides the fact that you may want to grab a pint of chocolate ice cream when those hormones go crazy, we're going to talk about why estrogen matters. So I get this question a lot. Especially for women that are postmenopausal, with patients that are breastfeeding. And during these times of women's lives, there is actually a depletion of estrogen. And okay, wouldn't that be a good thing? Because, then you aren't so crazy hormonal all the time. Well, actually, your body, especially the pelvis, is reliant on estrogen to keep that area happy. The pelvis is what's called androgen sensitive, which means that it relies on hormones like estrogen to alert the rest of the body that it needs attention to. So when people go through times of estrogen depletion where they don't really have that regular amount of flowing estrogen, then you're not getting those spikes of estrogen that you get when you are ovulating or right before you would start your menstrual cycle. And this can definitely interrupt that blood flow. You don't have anything waving a flag saying, over here, over here. The pelvic organs and the pelvic floor muscles are really reliant on that blood flow. And when they don't get blood, they get kind of hangry. There's all sorts of different things that benefit from the blood flow that comes from estrogen. The pelvic floor muscles can work better and can be stronger because they get more blood. The clitoris can have a healthy level of sensitivity. Some people without estrogen, it's less sensitive or actually even more sensitive because the nerves in the clitoris get irritated. The skin around the perineum and inside the vaginal canal can actually stretch better when there's estrogen. I'll have women that are postmenopausal that get tearing with insertion because there just isn't any blood flow, so that tissue just kind of gives way. It helps the vulva be healthy. So I see women that have really red, irritated vulvas, and you would think, well, red, doesn't that mean that there's blood? And it's not. That's the body saying it's craving for more blood. And so getting estrogen to those areas helps that tissue be pink and healthy versus red and splotchy and irritated. The bladder can empty better. The support structures for the sphincters work better, so the bladder can empty more efficiently. If you have a prolapse, that usually is, the symptoms are less severe in people if they've got some sort of estrogen. So that's something that people think have happened to them after they go through menopause. It's like, well, I went through menopause and now I have this prolapse. And they may have already had the prolapse, but that blood was actually keeping things from being symptomatic. So now it's a problem since those tissues don't have the nutrients that they need. There's a whole series of discussions worth having about hormone replacement therapy or the use of topical estrogen. And of course, you should talk to your provider and see if that might be a reasonable option for you if you're experiencing any of these symptoms. So what questions do you have? Let me know in the comments down below. Thanks for checking out my work, guys. It means a ton to me. I can't wait to see you next time.